right, welcome everybody. I'm excited to be here again. We are talking about, oh, there it is. Okay, so, all right, welcome everybody to our ninth Facebook Live event. Today we are going to be talking about pain, particularly recognizing pain in our dogs and our cats, and the different things we can do to try to help them out. Trying to hit some of our most common questions that we get around pain. Our pets, it can be kind of hard to recognize pain. They like to hide it a lot. They don't want to let you know, they don't want to tell you, and they tend to be rather stoic. Okay, a lot of that tends to be because they don't expect anyone to necessarily fix it for them. So the general adage for dogs and cats is adapt or die, and they are really, really good at it. So while we will always complain if we get a little bit injured, we're going to draw attention to it, we're going to tell other people about it, they tend to just be like, oh, okay, well that hurts, I'm going to avoid that. I'm going to learn to adapt with this, I'm going to learn to live with this, and I'm going to learn to continue to do the things I love to do despite whatever is ailing me. Okay, so I think that's kind of the crutch of the issue with recognizing the pain in our dogs and cats, is that it's going to be very, very subtle. Unless it's a very new, very sharp, acute pain, it's going to end up being a very subtle type of pain. Again, I just wanted to say that throughout this whole event, we do encourage you to submit questions. This is an extremely broad topic. I'm going to try to focus on a lot of the questions that I get, but if you have a specific question, please, please, please let me know, and I'm more than happy to talk about that, because like I said, pain is an extremely broad topic, so it can be very hard to know exactly which part of this topic would be better for us to focus on for you. Before I forget, we are running a couple of specials, and we have been, I guess I should say, been running a couple of specials throughout September. It's 25% off acupuncture treatments, and then on our online pharmacy, all of our joint supplements and pain medications are 10% off. So we'll kind of talk about, once we get rolling in here, what exactly did joint supplements do, why do we do pain meds, what's the point of it, how the heck does acupuncture fit into this whole scheme. Okay, so we can talk about that a little bit as we get rolling here. So as we get going, okay, I'm going to start with a couple really common questions. So let's first start with, how do we recognize pain? Okay, so what are the common signs, symptoms of pain in dogs and cats? So as I mentioned before, it tends to be very subtle in the early stages. You go to the doctor and the old joke is, oh, every time I do this, it hurts. And they just say, well, don't do that. So most of your pets will take that to heart. So if it hurts every time that they go up and down the stairs, well, they're going to be going up and down the stairs a lot less. It's going to have to be really motivating for them to want to go up and down those stairs in order for them to do it. They're just going to avoid behaviors. So if you have a dog that used to be your shadow and followed you everywhere, you walked to the laundry room, they went to the laundry room, you walked to the kitchen, they went to the kitchen, you walked outside, they went outside, your little shadow that went everywhere with you, and then suddenly they just kind of seat themselves in a corner of the room and they follow you with their eyes instead of with their legs. They probably have some pain when they're following you with their legs. A lot of people attribute it just to getting older, calming down. Our pets don't really mellow. I mean, they mellow in the sense that they don't get uber excited all the time, but they're still going to go with their bodies as much as they can and very excitedly. So if you notice your pet mellowing to an extreme degree, not just simply doing the same activity in a calmer fashion, but actually avoiding activities or not doing a certain activity as much, it can be an early sign that that activity is starting to get a little bit painful, and so they're going to do it less often. So I'd say that's probably the first kind of more subtle sign. Other things, obviously, if they get grumpy, that's another one. So a lot of times, particularly people recognize this in their older pets, They're going to want to watch the old dog around the grandkids, or they're going to watch them around the nieces or the nephews or the little kids. Because little kids, what they like to do is they like to run up and they like to body slam the dog as they lay on the floor. And if you're a little bit sore in general and somebody wants to come up and body slam you, you're going to get a little bit grumpy about it. You're not going to take it like you did when you were younger and just kind of roll with it and think this is a fun wrestling game. So that would be probably the other big subtle sign. We did get a question. First question we got here today is, can I give my dog Gatorade when he has a stomach ache? Gatorade certainly isn't going to hurt your dog. It does have a pretty high sugar content though. I'm not sure it's going to do a whole lot for the stomach ache. If you feel like your dog is getting dehydrated, sometimes it can help with electrolytes and rehydration. But generally, if they have a stomach ache, that makes me think that they just really don't want to eat or drink. It's not really going to cure the stomach ache. That would be more of a, you got to figure out why is the stomach hurting? Okay, are they starting to work on some diarrhea? Did they eat something that they shouldn't? It's not going to really relieve any pain. What it might help with is if they're getting a little bit dehydrated. So if they're not really wanting to eat, but they're still drinking, but not drinking as much as they should, then a lot of times getting them something more for electrolytes is helpful that way. But as far as treating the pain of the stomach ache, it's not going to do a whole lot. With that, like I mentioned, Gatorade has a lot of sugar in it. A little bit of a slightly better option for your pet if you're going for replenishing electrolytes is actually to pick up some Pedialyte. It's made for little kids, so they tend to make it a little less sugary. Granted, there's still plenty of sugar in Pedialyte, but it tends to have a little bit more of the electrolytes and a little bit less of the sugar. So that would be kind of the way I would go as far as that goes. But it's certainly not going to hurt at all. So trying to think other things that you can give your pet if they seem to be sore in a specific way that are over the counter that might help. A lot of times we get asked, can I give my dog aspirin? Or they'll come in and they're like, hey, I bought the buffered baby aspirin from TSC, and I gave it to them. The majority of people who do that end up walking through our clinic and saying, it didn't really do a whole lot. Or, was that okay? Because they weren't sure. So aspirin, let's talk about that, okay? The baby aspirin or the dog aspirin, whatever that you can buy from TSC to help treat your dogs with pain, aspirin in general, when given to dogs, has a very narrow window of effectiveness, okay? So you have to get a high enough dose that they actually get some pain relief from it, but not so high that the liver starts to suffer and it gets into the dangerous side, which is what you need to worry about. That window in aspirin is very narrow because aspirin was not designed for dogs. What we carry here in the clinic are pain medications specifically designed for dogs. So the big difference is that window of safety is much wider. Okay, and a lot of times what ends up happening is that in order for that over-the-counter pain medication to not hurt your dog when you give it, they tend to go dosing on the lower side of it. And when you have this narrow window of efficacy and you start to go towards the lower side of it, a lot of times you end up here where it's not effective. It's not hurting them, but it's also not doing a whole lot. And then you run into people who are like, well, that didn't work, I'm going to double it. Okay, well then you run over here. So now you're effective, but you're also hurting that liver. Okay? So I always tell people, if you think you might come see me about this painful situation with your pet, I ask that you please do not give them an aspirin, even if they start to get sore on a Sunday and I'm not open until Monday. Because if you give them that aspirin on Sunday, it ties my hands. So aspirin is placed under the classification of an NSAID, or a non-steroidal anti-inflammatory drug. And NSAIDs are one of the safer pain medications we use and one of the more popular ones. I have a much safer NSAID for your dog here at my clinic, and it's going to be much more effective for your dog. However, you cannot give 2 NSAIDs at the same time. It's too hard on the stomach lining and they're going to get bad ulcers with it. So if you give your pet aspirin at home on Sunday and you come see me bright and early Monday morning and you want a better pain medication because you don't think that really did anything for your pet, well, now I'm kind of stuck, because according to suggestions from the Food and Drug Administration and the general medical community, is you want to wait a 3-day washout period, okay, to make sure that there's no aspirin left in the system before I start up my NSAID, which could be a carprofen or a Galliprant or a meloxicam or any of those. Okay, there's a bunch. So, but all of them are under the same class. Okay, so unfortunately now I have a dog who has been given aspirin, is still painful, which is why you came to see me, but now I can't give him a really nice, safe, good pain medication that's inexpensive because I gotta wait 3 days. But I don't really want this pet to wait 3 days in pain because that aspirin really didn't help him that much. So then what we end up doing is we end up doing alternative drugs, okay? And the inexpensive ones are not as effective, okay, but it's better than nothing. Or we get into the very expensive ones. And what ends up happening with that is because we have to switch drug classes. And we don't want to put you on a steroid, because you also can't use NSAIDs or non-steroidal anti-inflammatories with steroids. Again, it's too hard on the stomach lining. So then we go and we end up having to give your pet like an opioid or another classification of drug. And those, the inexpensive or cost-effective ones, are not very effective in dogs. And so then if you want the expensive ones, they're very expensive. They are effective, but they're very expensive. And so what we end up doing a lot of the time, because most of our owners who do give their dog aspirins do have a lot of financial constraints, is we end up trying to just put them on this cost-effective opioid for a couple days, and then we switch them over to an effective NSAID. So unfortunately, the pet just has to stay in pain a little bit longer before we can get it fully controlled. So that's why I ask that you don't give your dog aspirin, and it's just because for the vast majority of pets, it doesn't actually control their pain, and it ties my hands, so I can't give you something that will control your pet's pain in a good way. Cats are a completely different story. Please do not give your cats aspirin. They lack an enzyme in their liver to fully process it that dogs do have, which makes it even more dangerous than cats. And it just does not end well if you want to give your cat aspirin. You either give them such a small, tiny, tiny dose that it will never do anything anyway, or you give them a larger dose and then your cat ends up hospitalized and in liver failure. So please do not give aspirin to cats. Not very safe at all. Dogs are able to handle it better, but again, you have that narrow window between being effective and being toxic. So that's kind of the main over-the-counter pain medication that we get a lot of pets coming in with. Beyond that, other over-the-counter things, thinking about stomach ache, people do give their pets Pepto-Bismol. Don't really have a problem with it again, and it could just be a bias, because if it worked, I wouldn't see the pet. But I do get a lot of pets in who were given Pepto-Bismol, but it didn't really work. Or it kind of helped firm up their stool a little bit, but then the owner can't stop giving it. The minute they stop giving it, the diarrhea and everything just comes right back. Same with kaopectate. We see that a lot as well with kaopectate. So that's kind of where I fall a lot of times on all of that. Now, if you have a pet that, you know what, you just can't come see me, and you want to give your pet something, it's fine. Kaopectate, it usually is fine. It doesn't really hurt him. I don't think it necessarily solves the problem a lot of the times, but it's not going to hurt them. As long as you obviously don't give too much of it, but you'll be fine. Other over-the-counter drugs that pets get given for discomfort. So nausea a lot of times gets thrown in with discomfort. So a lot of people will try to get, and the name just escaped me. It's the anti-nausea drug they use in people for motion sickness. I don't remember it off the top of my head. I know it begins with a D. It's escaping me at the moment. But that one, they'll come in a lot and have been given that. And again, I'm probably a little bit biased, because if it worked, I wouldn't have seen the pet. But I see a lot of pets that get given that, and they're still very, very nauseous. what we have here at the clinic, because we have specific anti-nauseas designed for pets, and so it is much more effective, and then you're able to actually treat that nausea, treat that motion sickness, and not get vomit all over your car. Okay, so that's kind of, if I think of more over-the-counter ones that we see walk through a lot, I'll try to mention them as we kind of go here, or if you have any that you particularly know of or have given on Dancitron. Yeah, that is one. That one actually isn't as bad. Sometimes with some pets that one will work, the Ondansetron. Now I think the Cerenia works a little bit better. Sorry, I just got a comment that said Ondansetron asking if that was the anti-nausea medication that I was thinking of. And that one, actually, we do see some efficacy with that. We've used it in the past. I think the Cerenia works a little bit better, but there's another one. I get an occasional phone call with it. I only get the phone call like once or twice a year, and it's an anti-nausea medication that you can buy from Drug Mart or Rite Aid or one of them, and people try to use it for motion sickness, and it just doesn't not work very well. But yeah, I'll have to, if I think of it, I'll mention it. But yeah, Ondansetron is one over the counter that they use a lot in people. At least I think it's over the counter, and we actually do see some efficacy with that one. All right, so kind of to, like I said, I'll loop back if I think of any other over-the-counter stuff that comes to mind as we work through here. So one of the questions that actually gets brought up is, do cats and dogs feel pain? And yes, 100%. Cats and dogs feel pain. It's not, I think it's more of a question of how much does it bother them? Well, that's hard to really answer. That's more of an emotional question. And as an owner, you're going to be able to answer that better than anybody else. But as to do they feel pain, yes or no? Absolutely. They definitely feel pain. They have avoidance behaviors. They have behavior changes. They get all of the same issues that we get, with pain. They get balance issues, incoordination issues. You'll get a pet who is very vocal and will cry out, who will whine, they'll hunch, they'll change their body posture. So the question of do they feel pain or not, I think it's unequivocally yes. It's just to how much of an extent does the pet let it really get them down, so to speak. And our pets, as I said before, it's adapt or die. So they figure out a way to live with it. Or in cats, particularly, I've never met a species more prone to just deciding if they want to live or die. And I think that a lot of our cats will just get to a point and then they'll just make the decision, like, okay, I'm done. And then that's it. And you could do everything under the sun to try to change that cat's mind. And once they've made that decision, that is what is going to happen. So, and then So other question I get asked a lot, because I do acupuncture, is what are natural pain relief methods? Okay, so my first caveat anytime I get asked about natural whatever, okay, is even when you're going the natural way, you are essentially giving a medication to your pet, okay, if it's going to be effective. The way we developed our drugs was we took the natural form, or the herbal form, or the herb itself, or the piece of bark from a yucca tree, or whatever. We took it, and we figured out what is that active ingredient, and then we purified it. And we purified it down to its little perfect element, and that was what we focused on, and that's what we give the pet. Okay, so what you're doing when you go for a natural pain relief is you are basically taking that drug in an unpurified form and giving it to your pet. Now, in some cases, that's actually more effective than giving that in the drug form itself, okay? And in some pets, particularly our older pets who have a lot of other things going on, you can get less side effects with that. So that actually, I think, isn't a bad way of thinking about it. And another analogy that I use a lot is a banana. Okay, so let's say I have a low potassium, and my doctor wants to give me a potassium pill. Okay, well, I will get so much potassium out of this potassium pill. The other thing I could do is I could just go eat a banana, and I would actually get more potassium out of eating that banana than I absorbed out of taking my potassium pill. Now, the advantage of the potassium pill is I'm going to take my potassium pill and then I'm going to eat a meal, which is going to give me more potassium. So it's a way you can like double down, so to speak. But if you're looking at pure absorption from a pill versus the organic form of it, so to speak, sometimes in some things you can actually get more out of the whole unpurified form than you can out of the purified form. So examples of these natural pain reliefs methods that seem to be effective. One that's really common, you can get it over the counter, is turmeric. Turmeric is just an herb, and it has been shown to decrease inflammation in general, things like that. Other ones that people have used a lot, you can buy a lot of herbs over the counter, and you can see, like, you know, certain ones will also decrease inflammation throughout the body. Joint supplements actually do this as well. So your Thasaquin, your Cosequin, your joint sulfates, anything with the fish oils or increased omega-3s, those things like that. It changes the composition within our cells and makes them less inflammatory in general. So if you have a lot of saturated fats in your cells, so if you're a human and you eat a lot of potato chips because they taste delicious, you get a lot of saturated fats. Your body, that makes up your cell content, okay? So your body stores a lot more of these saturated fats, and those saturated fats have a lot more inflammatory factors. So anytime any of your cells then get irritated from anything, arthritis, running into a wall, your brother hitting you over the head with shovel wax in it, anything like that, those cells become and release more inflammatory factors than somebody who ate a lot of olive oil as opposed to potato chips. Okay, so olive oil's got a lot more of your omega-3s and less of the saturated fatty acids. So you can play around with the diet itself as another way, and that's the way a lot of these supplements and other things that help with arthritis, pain, and all of that work as well. They are also working on a cellular level to decrease the amount of inflammatory factors that your body releases. And so then that's where I kind of also come into play with the whole Eastern medicine thing, okay? So kind of moving along those lines. Then you hit something that tends to be a little bit more poignant, is the herbals themselves. And the reason they're a little bit more poignant is that they have been shown over thousands and thousands of years, basically through trial and error, that these are very effective at decreasing inflammation throughout the body and decreasing swelling. Okay, they will increase blood flow, which helps to remove those waste products out of there, and the more waste products you remove, then the less inflammatory factors hang around, and it breaks up that cascade of inflammation. Okay, and if you can break up that cascade, it's going to break up that signaling back up to your body. Okay, so pain is such an interesting concept in the body. Okay, so you don't really have, well, we're going to back up a little bit, and I'm going to get really nerdy on you for a second. Okay, so you don't actually have pain receptors throughout your body. What you have are called nociceptors. Okay, and some people like to cheat and say that those are pain receptors. They're not. They're just another sensory receptor in your body, in the periphery. So these nociceptors go and they get stimulated, and they send a signal up into your spinal cord that then triggers more signals, and then it sends it up to your thalamus, which is a part of your brain, and then it triggers it up and sends it to your cerebellum, and then also over to your cortex. Okay, and when it goes to those places, okay, that nociceptor, when it goes to your cerebellum, gets processed as proprioception. Okay, so that proprioception is knowing where your body is in space. Okay, so if you close your eyes, this is an easy cheat. If you close your eyes and you hold your arms out, you know where your fingers are. Okay, I moved my fingers. I know where they are. It didn't hurt me to move my fingers. Okay, but that signal of me moving my fingers one of the receptors, because there's a bunch of them, that feeds back to my cerebellum to tell my brain where my fingers are is a nociceptor. So nociceptors don't always equal pain. A lot of times your body also, they're kind of dual purpose. It also uses it to tell you where you are. When that same thing gets kicked up to the cortex, okay, then your body processes it. And it processes it, and your cortex is saying, that hurts. Okay? So there's a lot of steps all along here, right? And then why do some of these just tell me where I am, and why do some of them tell me that I'm in pain? And that's because of all of the other sensory receptors that are getting signaled at the exact same time. Okay, and some of them dampen the sensation of nociceptors. So when those get dampened enough, then you're really just part of your proprioceptive mechanisms and telling you where you are. If they don't get dampened, then they go up into the brain and they get signaled that you're getting overwhelmed with these nociceptive signals, and then your body processes that as pain, as in, oh, that's a bad thing. Okay, now your inflammatory factors, okay, that get released from a cell when it gets damaged, increases the firing of these nociceptors. Okay, and it increases, so that's where you get the inflammation and all of that, and it's going to increase the firing of all of these, and then it's going to go up and it's going to get signaled in the brain that this really hurts, and then it's going to get amped up even more. So the more a body uses something, the more amplified it gets, because the body feels that it's more and more and more important. So once you get signaled a whole bunch, okay, with these nociceptors, the body strengthens those signals. So then they're going to fire easier, and they're going to fire faster, and they call this the ramping up effect of pain, okay? And so then it gets signaled more and more and faster to the cortex. So then something that, particularly with chronic pain, is when we see this. We see this amping up on a neurologic level of this pain, and then the animal avoiding more and more behaviors and displaying more and more pain signs, which is the aggression and the avoidance and the limping or the crying and all of that. So how do I break that cycle? Well, these are different things are breaking that cycle on all these different levels. Okay, so you're from a cellular level, when you change the composition of that cell with the omega-3s or the saturated fatty acids, all of that, you are decreasing the amount of inflammatory factors that get released to initially start setting off the increased firing of your nociceptors. So you're treating it at a cellular level. In my herbs, they tend to treat it, again, not really changing the composition of that cell itself, but it's going to change that signaling. It's going to increase the blood flow, and it's going to move those inflammatory factors that it produced out of there faster. It's going to keep everything flowing and going well. And so you're going to get less of that feedback mechanism firing back up to the brain to tell you something hurts. With my needles, when I do acupuncture, where am I entering this system in that place? Okay, well, I can enter it in a couple different ways. If I do local points, I'm going to increase that, and I'm going to remove those inflammatory factors. I'm going to flush them out, essentially, of the system that way. But I'm also going to do distal points, and I'm going to do other points as well. And what that's going to do is it's going to cut off that amping up. It's going to cut off that feed going up into the brain, okay? And so, again, it's going to decrease those nociceptors. The other thing it does, and this is really fun, is I'm going to stimulate other receptors that naturally dampen your nociceptors, okay? So, again, to kind of nerd out a little, okay, your nociceptors are small diameter fibers. These other receptors are large diameter fibers, okay? And every time a large diameter fiber in the nervous system is signaled, it dampens your small diameter fibers, because your body likes those more. They think they're more important, okay? And so what it does basically is it dampens and it shuts down more of those nociceptors. It shuts down more of that signaling that your cortex can then interpret as pain before it actually gets there. And so you decrease the body's signaling up there. Additionally, you're going to change the way the body interprets it. So you're going to interpret it less as pain. You're going to interpret it more as other things. All right, and that's part of the reason why. And when you signal these large diameter fibers through acupuncture, or if you go ever get chiropractic on your pet or yourself or anything like that, you're going to trigger these large diameter fibers more, and it's going to dampen those nociceptors. It's also going to release essentially relaxation factors, for a lack of a better thing. Okay, so it's going to cause muscle relaxation. It's going to trigger your DTOs and all of those, and it's going to help you relax. It's going to help you eliminate the pain on a lot of different levels. Where do drugs fit into this? Okay, so we talked a lot about all these alternative things. Okay, great. So we're going to decrease inflammatory factors. We're going to stop the ramping up mechanism. We're going to make the brain think that that's not actually pain. You know, it's really cool, and you can do a whole lot with this. Well, where do drugs fit in? All right, so drugs fit in back on a little bit more of that inflammatory cascade, okay, on that cellular level. So we talked about changing the composition of the cell to release less inflammatory factors. And then, okay, well, what if I get into the cell and I don't change the composition of the cell, but I make it so the cell can't produce as many inflammatory factors? So in that inflammatory cascade, I'm going to jump in with my drug here, and I'm going to cut it off at the heels. Okay, so it decreases inflammation and all of that. Because you're cutting off this cell process, you're not dampening it down or redirecting it or any of the other things with the other methods. Because you're just cutting off that cell process right there, not only do you make it so that you don't get all these inflammatory factors, which cause a lot of pain, inflammation, all that bad stuff, you also don't get any of the good stuff that it does. Okay, so because you're just treating one section of it, and you're not involving the entire body to come together, because everything is talking to everything on a constant basis in your body, that's why you get side effects with your conventional NSAIDs and medications and things like that. A lot of times the side effects are fine, and sometimes we actually give a drug to use its side effects. For example, steroids. They are an extremely strong anti-inflammatory. They work very, very well. One of their side effects is it makes you hungry, okay, which doesn't really make a lot of sense. It's an anti-inflammatory. Why would it make me hungry? Well, it's because of where it jumps in on these cell processes and in these signaling pathways. One of the side effects is that it makes you hungry. It also makes you thirsty, and sometimes you can see some behavior changes, but that's usually fairly minimal in our pets. So why would I use this without my number one reason wanting to be an anti-inflammatory? Well, we get a lot of pets in who are inapposite. Well, a lot of times when you get uncomfortable, your appetite just goes down. You kind of feel like crap, right? So if I have a pet who's not wanting to eat and has inflammation in the body making them not wanting to eat, so they feel kind of crappy, I'm probably going to reach for a steroid as long as it's not contraindicated for some other reason, because I can use that side effect to increase their appetite. In addition to decreasing the inflammation and treating the main source of their problem, I can then use the side effect of this drug to help them feel even better. We use it a whole lot as well when we're treating, we had the question about GI discomfort. When we treat a lot of GI discomfort with stomach aches and things like that, one of the medications we use a lot is called metronidazole or Flagyl. One of the side effects of this drug is it decreases inflammation locally throughout the GI tract. Awesome. Is that like what the drug was initially made for? No, but it does it. So I'm going to use it. So just because something gets labeled as a side effect, okay, basically a better way of thinking of it would be another effect of the medication that it wasn't specifically designed for. But that doesn't mean you can't use that to your advantage in some cases. So even though some people would look at that and say, oh, well, I want to treat this from all levels. I want to get the whole body involved. I don't want to have side effects. I don't want to have any of that, okay? Just because it has a side effect doesn't mean that you shouldn't use it, or that the side effect might not help you more, okay? I do believe in getting the whole body involved. I also believe in giving conventional pain medications. There are a lot of situations where you can't fully eliminate that pain, you can't fully bring down the inflammation without chopping that cascade off at the heels for at least a little while, okay? Let the body chill out for a little bit. So I mentioned, the more these signalings happen, the more the body strengthens it, the harder it gets, the stronger it gets, the faster it gets. Okay, well, if I chop it off at its knees, even just temporarily, okay, I'll get a little side effects. But if I chop that off, that's not signaling that anymore. I've stopped it. So it's another way you can kind of cut off that ramping effect as well, okay? And then the body is going to decrease a lot of these extra signaling that it had, and it's going to make the signals you get when it comes back a little less strong. And if you are using the other modalities, particularly in combination with that, that's going to give you your best control possible, because you can't cut something off forever. The body will find a way around it. It always does. So if you're like, well, screw the side effects, I don't care, I'm going to keep my pet on high doses of whatever for a really long time, then I'm going to just deal with it. Okay, I mean, you can, but the pain will find a way back up to the cortex, okay? It will find a way to signal back up there and keep the body from hurting itself. Pain in and of itself, in its purest form, is not a bad thing, okay? If you cannot feel pain, you will destroy yourself. And there is some people who are born with this condition, and it's fascinating, but they won't feel pain, and they'll break their leg and they'll have no idea, and their leg will be rotting off from an infected wound and they'll have no idea. The other thing that happens is, because it's part of this big signaling pathway and the processing routine and everything, it triggers so many other things, and they don't heal. Okay, these people who have absolutely no pain sensation don't heal because none of the other things are signaled to go send healing vectors to that area. So pain isn't necessarily the enemy, okay? In short term. In long term, that pain signal gets amped and amped and amped and amped and amped and amped. And that's what we need to stop. That's the crippling effect of pain that you need to stop. And that's where we're trying to intervene here, okay? Short-term pain, I smashed my finger. Okay, yeah, I probably shouldn't use my finger until it heals for a little bit. No, I'm still going to take anti-inflammatories because, it's the anti-inflammatories aren't going to completely get rid of that sensation, and it's going to help my finger heal faster because I don't need that amping up effect in my finger because I just smashed my finger. I know it hurts a little bit. I won't use it. If I can just keep it at that level until it goes away and it heals on its own, I'm golden. Okay? So it gets complicated in that sense, but at the end of the day, okay, thinking about the pet that has a chronic pain issue, I think that using all of the approaches together is really the best way to go. And one of the nice things about using some of the alternative therapies or the natural pain relief methods is that it's going to decrease the amount of drugs we need to get over the long term. And that's going to decrease your side effects over the long term. And you can usually get more time with your pet at a good quality of life for longer. Because that's what we want. We don't want a long, miserable life. Okay? We want a long, happy life. And I always tell people, when you get a lot of pets in who are in a lot of pain, who have a lot of problems, and we try everything. But at the end of the day, I always tell people, because they feel bad for our pets who need to be maintained on steroids, okay? A short, happy life is better than a long, miserable one. And if this is what we need to do, this is what we need to do. And when the side effects get too bad, you know what? It's not a happy life anymore, okay? I know I would prefer a short, happy life to a long, miserable one, and I think everybody else would agree. So when you're looking at your pets, I'll try to bring it all back in here and wrap it up and make it a little better. Okay, if you're looking at your pet and you're wondering, is my pet in pain? I want you to sit there and I want you to ask yourself, is my pet avoiding behaviors that it used to do? Is my pet grumpier? Does she dislike it when I do things that I used to do? For example, when I brush her, or when I scratch behind a certain area. Do they not like it? Do they get away from me? Do they curl their lip? Do they growl a little bit? Are they avoiding using a certain body part? So limping is pretty obvious. Okay, if they're not using something, it's usually because it hurts. Okay, cats can be really hard. Is your cat hiding more? Is your cat sleeping more? Is your cat looking at the counter and thinking about jumping before it actually jumps up there to eat its food? Or does it just not jump at all anymore? Okay. Is your cat grumpy? Does your cat suddenly not like something that it used to like? Those are all things. Now, the obvious signs of pain, yelping, limping, all of that, those are pretty easy. But everything I just listed are all things that you can look at for your dogs and cats and to try to help you decide, is there something that hurts them? That would be kind of where it would start. And if you decide, okay, I think something hurts them, all right, then you have to figure out how much is this affecting their life and how aggressively do we need to treat this? And we can definitely help you with answering that question, okay? If your pet is still doing well and we've caught this really, really early, a lot of times just doing a little bit of large diameter fiber stimulation with acupuncture or trying to move things through a little bit more with certain herbals, and you can even try that at home with like a little turmeric or a little joint supplement, anything like that. A lot of times, sometimes if you catch it early, that's more than enough, and they get back to moving and grooving, and you can tell. They're like, oh, hey, I got my dog back. We get that a lot, he got old, oh, wow, he's like a puppy again, okay? That's kind of the idea. If you feel like your dog is just, he's just getting old, maybe try treating some pain. See if he turns into a puppy again. Because our pets love to do everything with us. And see if we can't get him back to that point. So that's kind of, I think, a really good stopping point. We're kind of running up on time here as far as that goes. So just to kind of wrap it up again, it's a really broad topic. I hope I hit the stuff you guys wanted to know about. I tried to cover some of the big topics. If there's anything that I mentioned today that you want to know more about, so if you want to know more about nerve signaling, I can do that. If you want to know more about acupuncture, if you want to know more about chiropractic, if you want to know specifically more about herbals and different kinds, so if you want more specific examples of those products and those types of things, I can do another one of these on something like that. You just gotta let me know. If you want to know about more specific actual pain medications that we use that you've seen on your bill when you've left the vet clinic, well, what does this do? My vet said this was for joints. What exactly is that one? What class of drug is that? And what is it blocking? And all of that. So yeah, I can go into all of that stuff. Specifics like that. If I'm not personally familiar with it, I'm going to need a little bit of prep time. So if you could, send it to me, we can definitely go and talk more about any of that stuff. So that's what the questions and all that is really, really good for. So I love questions. Please send me some questions. Just to kind of wrap up again, I want to just give a big thank you to everybody here at the clinic that allows me to do all of this. We have a couple other really great vets here at the clinic. They do a wonderful job. It's always really good. Next month's theme, October, is National Pet Wellness Month. So we're going to be talking about things we can do just to try to maintain wellness. A lot of preventative care talk, that kind of a thing. Again, this is a really huge, broad topic. So if there's some type of specific preventative wellness that you would like us to focus on, please let me know. I already talked about our online pharmacy, all of that. We do have a TikTok channel and a blog, so go ahead and like us and follow us on that. I do post a little blog every month, and then we are trying to post more videos of cute puppies and kitties on our TikTok channel. So keep an eye out for that, and I will wish you all a good night.